Hi, my name is Dr. Andrew Pazandak, and thank you for considering us for your cataract surgery. There are a number of different choices that we have to make when it comes to cataract surgery. The first is whether or not we should do the surgery fully manually or partially with laser. Manual surgery is a safe option and sometimes is the best option for patients. Laser-assisted cataract surgery is where we use a laser to perform part of the cataract surgery. It is especially important when we're correcting for astigmatism or using any of the premium lenses that sometimes require a little more precision than can be achieved with manual eye surgery. Okay, let's talk about expectations. In cataract surgery, the primary goal of the surgery is to remove the cloudy lens from the eye and replace it with a clear lens. Doing so will improve the quality of your vision by removing the symptoms from cataracts. The secondary goal of the surgery is, since we're putting a new lens in the eye, and we do want to put something in the eye because if we don't, you'll require very strong glasses to be able to see, is to try to reduce your need for glasses afterwards. We can never guarantee that you won't need prescription glasses to see your best. Depending on how that eye heals, if it heals differently than we anticipate, you could be left with a small prescription. If it's just a small prescription, it may not even bother you. If it's more than that, we may be discussing wearing glasses to see your best or what other options we can do to improve your vision. Cataract surgery, just like with any surgery, has risks. Any type of eye surgery carries the risk of vision loss. Thankfully, with cataract surgery, that is very rare. There are more common problems that can happen. It's normal to have some swelling in the eye after surgery, which can cause your vision to be blurry. This typically improves relatively quickly over a few days. Sometimes if you have complications during the surgery, you may need additional surgery. When you come in for your cataract evaluation, you will meet with a surgical counselor, go over the details of your surgery, in addition to what you need to do to prepare for surgery the night beforehand. Cataract surgery is a quick and painless surgery. It takes about 10 minutes to do. Our goal during the surgery is for you to be aware that you're having surgery, but we give you an IV to help you relax, and you may or may not remember the surgery. If you do remember the surgery, it's not a miserable experience. Most patients describe some pressure and seeing a crazy light show. That night after the surgery, you may feel like you have some sand in the eye or maybe have an ache. All you need is Tylenol or ibuprofen. That typically resolves by the next day. Vision the first day after the surgery is typically a mixed bag. Sometimes patients are seeing well, sometimes patients have blurry vision. It just depends on how much swelling you have, and as that swelling improves over several days, your vision will improve. It's also important to follow the postoperative instructions and restrictions to make sure that your eyes heal the way they should. So after cataract surgery, your cataracts will not come back. However, it's common to develop some scar tissue on the lenses that were implanted, typically within the first 1 to 2 years after surgery. When this happens, it can cause similar symptoms to cataracts. However, it does not require an additional cataract surgery to fix. It can be taken care of with a YAG laser that will fix the problem. A YAG laser is a minor laser procedure to clean off scar tissue. It's necessary about half the time after cataract surgery. Cataract surgery is one of the most common surgeries done in the world. The vast majority of times things go very well. You're in great hands here, and we can't wait to help you see better.